Hi folks, I'm Dr. Chris Novak. I'm a pediatrician and a RIME pre-clerkship educator. This podcast will present an overview of child development and developmental surveillance. I still have no financial disclosures, and I've taken appropriate steps for copyright. So let's start with the case. You're working in a primary care clinic. Today you're seeing Ola, an 18-month-old child assigned female at birth. Her parents brought her in today because they are worried about her development. They describe that she walks with a steady gait, can self-feed with finger foods, and drinks from an open cup. Ola's family speaks English at home. She says mama and dada, referring to her parents, but has no other words. She makes less eye contact than her siblings and does not point at objects. Ola often gets frustrated and has tantrums that can be difficult to manage. Ola's parents are concerned that she may have a developmental delay. How will you assess her parents' concern? After listening to this podcast, the learner should be able to, number 1, identify evidence-based references for assessing developmental milestones. Number 2, define developmental surveillance and screening. And number 3, apply milestone charts to recognize developmental delays. Childhood is an incredible period of change, as children rapidly acquire new skills and develop towards adulthood. Many children follow a common developmental path within a common time range. Some children follow that path at a slower or faster rate than is common. Child development can be broadly broken down into 5 domains: gross motor, fine motor, communication, cognitive, and social-emotional. Gross motor refers to movement of the whole body and includes movements such as rolling, sitting, standing, walking, and running. Fine motor development refers to the use of the small muscles of the hands and wrists to perform actions such as gripping small objects, feeding with utensils, and drawing. Communication development refers to both verbal and nonverbal, and expressive and receptive communication. This may include speaking and demonstrating understanding by answering questions or completing requests. Cognitive development refers to learning and problem solving and is assessed through skills such as play, counting, or tasks such as sorting objects. Finally, social development refers to the development of social interaction and relationships through assessment of behaviors such as eye contact, pointing, and shared play. Before moving on, I want to highlight that much of the field of developmental pediatrics is based on the medical model of disability. As you've learned previously, in the medical model of disability, people are viewed as being disabled by their impairments or differences from socially constructed norms. An example of this would be considering people who use wheelchairs as disabled, but not considering people who wear contact lenses in the same way. In contrast, the social model of disability says that a disability is caused by the way that society is organized, rather than by a person's impairment or differences. Neurodiversity describes the idea that people experience the world in different ways, and there is no correct or superior neurology. There are some children who will develop at an accelerated rate, also referred to as precocious, and others who gain skills at a slower rate, also referred to as developmental delays. It's not our aim to pathologize differences in development. The goal of assessing child development is to assess children with developmental differences that could eventually lead to impairment and disability. By identifying these children, we can consider supports or accommodations to help children function optimally in society as it stands today. At the same time, our society and our healthcare system can work to remove barriers to participation for disabled and neurodivergent people. Developmental delay refers to a clinical presentation where a child has not met a developmental milestone by an expected age. The term developmental delay is typically used for young children less than 5 years of age, as we're still determining what that child's developmental trajectory might look like. The term developmental disability refers to an impairment that is not expected to resolve. This term is used instead of developmental delay for older children and adults. Developmental delays may be caused by medical conditions, for example, untreated hypothyroidism impacting brain development, social factors such as neglect, or primary developmental disorders such as cerebral palsy. The American Academy of Pediatrics describes developmental disorders and developmental disabilities as a range of childhood mental or physical impairments that result in substantial functional impairments in major life activities. Developmental disorders can impact multiple domains of development. For example, for some patients, cerebral palsy can impact both motor, communication, and cognitive milestones. Developmental regression refers to when developmental milestones that have previously been obtained are lost. For example, a child who starts to lose their ability to speak or walk. This is a very concerning sign and may suggest a neurodegenerative condition such as Rett syndrome or an inborn error of metabolism. Finally, another important concept in this field is adaptive functioning. This refers to how a person independently manages demands of daily life compared to others of a similar age. An assessment of adaptive functioning is important to recognize how differences in development may impact daily function. Clinicians need to be able to recognize typical developmental progression to diagnose developmental disorders. To do this, we use developmental milestones. Most children develop in a predictable series of steps called developmental milestones. For example, children typically learn to sit before they learn to walk. There has been a lot of research to determine what ages children typically obtain different milestones. If you look online, you'll find a wide range of milestone charts, often with very different milestones, which can get kind of confusing. The core reason for the differences in these charts probably comes from a question about what we define as typical development. Although not all developmental skills follow the bell curve, let's use this principle as an example. About 50% of children will start walking by 1 year of age, and about 90% of children will walk with a steady gait by 18 months. If we define the milestone by what's average, or the 50th percentile, then 50% of children at age 1 will not meet that milestone. This can create concerns from parents and clinicians when many of these children actually have typical development. In contrast, if we define the milestone at the 90th percentile, then only 10% of children will be identified as delayed. This allows us to focus efforts on supporting children with more significant impairment who will benefit most from support and intervention. We will be using 90th percentile milestones as an indicator of developmental delay in our curriculum. These are presented in the Crucial Skills Developmental Milestone Chart. This chart was recently developed by a team at the University of Alberta and includes updated, evidence-based milestones. These milestones will also be included in the next edition of the Rourke Baby Record. Because these milestones reflect the 90th percentile of typical development, if a child has not reached a milestone, it reflects a developmental delay and probably warrants further assessment. We will practice using these milestones throughout the curriculum as we learn about different developmental disorders. You can also practice them in this week's cards. The early recognition of developmental delay is important so that these children can benefit from early supports. Early intervention programs include speech therapy or physical therapy and are most effective if started as soon as possible. Developmental surveillance is defined as the process of identifying children at risk of developmental delay. The Canadian Pediatric Society, or CPS, recommends developmental surveillance at each primary care visit for children until the age of about 5 or 6, or whenever families raise concerns about development. Developmental surveillance can include asking about age-appropriate milestones using a reference chart such as a Crucial Skills table. Surveillance also includes direct observation of the child during your assessment and physical exam. Through your interactions with the child, you may observe developmental milestones such as gross motor skills, communication, and social engagement. Cultural and structural factors influence how, when, and whether or not parents seek assessment for their children. For example, due to negative experiences with the healthcare system, some families may only seek medical care in emergencies. Evidence shows that there are health disparities in the recognition of developmental delay. A recent Canadian study found that racialized children were less likely to be diagnosed with developmental delay than non-racialized children, although we would not expect race to affect the true incidence. This is more likely due to disparities in accessing care. Another study found that Black and Latinx children were also less likely to receive services to support developmental delays. Universal developmental surveillance is one step towards the goal of health equity. Next, developmental screening is defined as using standardized tools to identify developmental delay. Screening is more standardized and rigorous than developmental surveillance. The AAP, or American Academy of Pediatrics, recommends formal developmental screening at 9, 18, 24, and 30 months of age. There are multiple different screening tools that can be used. Broadband screening tools look at development across multiple domains. Example of broadband developmental screening tools are the Ages and Stages Questionnaire, the ASQ, and the Parents' Evaluation of Developmental Status, or the PEDS. These are proprietary products that can be purchased by clinics. Narrowband screening tools look at specific areas of development. For example, the Modified Checklist for Autism in Toddlers, revised, or the MCHAT-R, is a specific screening tool for autism. When developmental surveillance finds symptoms suggestive of autism, the MCHAT-R can be used to explore autism symptoms in more detail. Of note, a positive result on a developmental screening tool alone is not sufficient to diagnose a developmental disorder. For example, a child with a high score on the MCHAT-R has a high likelihood of having autism, but still requires a full diagnostic assessment. Making a diagnosis requires further assessment and may be done in collaboration with specialists in pediatrics and allied health professionals. If a patient has a developmental delay, this will require further evaluation. This includes a complete history, including medical history of conditions that may contribute to development, prenatal and perinatal history of risk factors such as alcohol exposure, prematurity, birth trauma, or resuscitation, a family history of developmental disorders, genetic conditions, or other concerns, and a social history including ACEs and other social factors that may impact development. The physical exam will include a complete general exam assessing for undiagnosed medical conditions, such as heart murmurs, birthmarks, or differences in weight, height, or head circumference, looking for distinctive facial features or congenital differences that suggest a genetic condition, and a neurologic exam assessing tone and gait. Initial investigations include hearing assessment by audiology and vision assessment either by optometry or ophthalmology. Unrecognized vision and hearing impairment can impact development. Of note, newborn hearing screening is not sufficient, and a full audiology assessment is recommended. Further evaluation for the etiology of developmental delay will be guided by the specific concerns and will be explored more in future podcasts. If you're concerned about development and require additional support, you can refer to the child to a pediatrician for further evaluation. Children with developmental delays can be referred for early intervention and support. Service providers might include speech-language pathologist, SLP, a physiotherapist, PT, occupational therapy, OT, or other community agencies. Programs will be different in every jurisdiction, but in Alberta, the Program Unit Funding, or PUF program, is available for children aged 2 years and 8 months to 6 years and can provide a range of support and funding. So let's return to our case. Recall that Ola is an 18-month-old child assigned female at birth, presenting with concerns about developmental delay. You review her milestones using the Crucial Skills chart. She has demonstrated the 18-month milestones in gross motor, where she walks well, carrying toys, fine motor, puts an object in and out of a container, and self-feeding, and cognitive, where she imitates new play. However, she has not achieved some communication or social milestones. She only says 1 to 2 words, where the 18-month milestone is 10 words, and she does not follow one-step directions. She does not point to show adults things, also referred to as joint attention, and makes infrequent eye contact, but does respond to games. You complete a detailed history and physical, which does not identify any further concerns. You review with your preceptor what you've identified about speech and social delays. You identify that this clinical presentation could represent autism. Given this possibility, you do specific developmental screening with the MCHAT-R, which shows that Ola is likely autistic. You share this possibility with the family and refer them to a pediatrician for a formal diagnostic evaluation. While they're awaiting this consultation, you refer them for vision and hearing assessment, as well as SLP support. Let's wrap up with a few key take-home points. Number 1, developmental milestones reflect the typical ages by which most children demonstrate certain developmental skills. Number 2, developmental surveillance involves assessing developmental concerns on history and physical and should be done at each periodic health encounter. Number 3, developmental screening involves using standardized screening tools such as the Ages and Stages questionnaire or the MCHAT-R. Thanks for listening.